Other daytime symptoms include the heart racing. We call it palpitations, and that could be a sign that heart is irritable, and it may be related to what's happening while they're asleep, that they're not getting enough oxygen because of sleep apnea, and then it can translate to an irregular heart rhythm.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Neki Mohan. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're diving into a vital, yet often overlooked aspect of our daily lives that holds the power to transform our overall well-being, especially when it comes to our heart health. It's sleep. We're joined by Dr. Dionne Morgan, a sleep medicine physician at Baptist Health Miami Cardiac and Vascular Institute. Thank you so much for being here.
Thank you.
We're going to dive right in. Dr. Morgan, can you explain the link between sleep disorders and heart health?
Sure. Thank you for having me today. I'm excited to be here. So, yes, there is a strong link between sleep disorders and heart health. We do know that specific sleep disorders can contribute to an increased risk for cardiovascular disease, difficult control high blood pressure, and even strokes as well. So there is a strong link.
Yeah. What are some of the common sleep disorders that negatively affect your cardiovascular health?
Sure. So one of the most common ones is obstructive sleep apnea, or we normally say sleep apnea or OSA. And that involves breath pauses while you're asleep because your airway is collapsing. And that leads to low blood oxygen levels. And then that can contribute to stress on the heart and the brain. And then that translates into increased risk for cardiovascular disease and increased risk for difficult to control high blood pressure. There's also insomnia, which can be difficulty falling asleep or staying asleep, or you're waking up in the middle of the night and you're not getting enough sleep. And again, that reduces the quantity of your sleep. And it has been associated up to 50% with an increased risk for heart disease and again, strokes. And then lastly, just short sleep duration. The American Academy of Sleep Medicine recommends at least 7 hours of sleep average each night. But we know, given our work lifestyle, it's easier said than done. And there is a strong association between a short sleep duration, so less than 7 hours, and risk for weight gain and obesity. And obesity leads to diabetes, high blood pressure, and heart disease. So it creates almost a vicious circle.
Yeah, no, so important. Are there signs or symptoms that people should watch for that might indicate a sleep disorder that can affect their heart health?
Certainly. So again, for sleep apnea, look out for snoring. If they're waking up during the nighttime, multiple times during the night, even to wake up to use a bathroom, that could be an indication that something's affecting the quality of their sleep and they may not be breathing properly. They could find that they're a lot more fatigued and tired during the day, that they're taking naps more often than they should. Again, with the insomnia, if they're struggling to stay asleep during the night, those are some symptoms they could look out for. Other daytime symptoms include the heart racing. We call it palpitations, and that could be a sign that heart is irritable, and it may be related to what's happening while they're asleep, that they're not getting enough oxygen because of sleep apnea, and then it can translate to an irregular heart rhythm.
So let's talk about improving sleep quality. How does that affect someone with existing heart conditions, and how can it help them?
Well, improving sleep quality has to do with good sleep hygiene, first and foremost. Keeping a consistent bedtime, keeping a consistent wake time, and then ensuring that you're getting enough hours of sleep. But it's not just the quantity, it's also the quality of the sleep. So again, anyone with a pre-existing heart condition, such as atrial fibrillation, which is an irregular heart rhythm, should probably be evaluated for an underlying sleep disorder, such as sleep apnea, because at the end of the day, you want to optimize the overall health of the patient and in particular their cardiovascular health.
Yeah. How is your experience as a critical care physician, your background, pulmonary disease, influence your approach to diagnosing and treating sleep disorders? Like we said when you came in here earlier, you're so much smarter than we are. You have so many different disciplines, but they all kind of feed into each other.
Absolutely. So I practiced critical care medicine for the last 10 years. And in the intensive care unit, we have the patient and they're sedated. Sedation does not equal sleep. They're just sedated. And if you think about it, how can you be asleep if there are lights on, there are alarms beeping, there are people touching you, someone's checking your blood pressure? So patients in the hospital, even if they're not in the ICU, do not get good quality sleep. And that's something that I've tried to focus on. Turn off the lights at night, minimize the sound in the room, get the patient out of the intensive care unit as soon as it is feasible to do so, because good sleep is associated with good health, and poor sleep quality and poor sleep quantity can lead to an increased inflammation within the body, and it can lead to more adverse outcomes. The patient may not recover as quickly from the acute illness. Similarly, in pulmonary medicine, which is why I became interested in sleep, is we would see a lot of patients with sleep apnea. We would even see patients with insomnia. And there is a strong association between certain chronic lung diseases and poor sleep quality. If you're not able to breathe while you're awake, you're going to have difficulty breathing while you're asleep. And that will contribute to inability to sleep well, and that can contribute to insomnia. We also know that there's a strong association between asthma and obstructive sleep apnea. I apologize. And if you treat the obstructive sleep apnea, that does help improve asthma management. So one of my practices in the past has been any patient with chronic lung disease, just to do routine screening for their sleep quality.
And the first thing that comes to mind when you're talking about a patient with a lot of beeps going off, people sleep with their TV on all the time.
Very true.
That's like an easy, quick fix, right?
Very true. Turn it off.
That's right. Well, how does the treatment for sleep disorders differ for patients with pre-existing heart conditions?
So the treatment really doesn't differ because, again, it's all about optimizing health. It is just for us physicians being more conscious and aware that maybe we should screen this particular patient that has heart failure or recently had a heart attack or a stroke for obstructive sleep apnea, and assess their overall sleep quality. Because if they do have untreated obstructive sleep apnea, you want to optimize that aspect while they're sleeping, so it will translate into good health while they're awake.
Now, what kind of lifestyle changes can people make to improve their sleep and their heart health? We just said, turn off the television.
Right. And then the other routine lifestyle changes that are always recommended: increase physical activity. We know that patients who sleep less, they tend to be tired, and then it's harder to find the energy to work out during the daytime. So just routine physical activity, walking 5-10 minutes a day is better than nothing at all. Good food choices, healthy food choices, and trying to keep a consistent bedtime and wake time. Even if you're only able to sleep for 5 or 6 hours, consistency is key. And consistency is what leads to good sleep hygiene.
Right now, almost everyone, Dr. Morgan, has wearable technology, right? I have an Apple Watch. Some people have other kinds of smartwatches. What insights can we get about our cardiac health during exercise and sleep with these devices?
Oh, excellent question. So the wearable devices have given patients access to more objective information that helps them track what's happening in the daytime and while they're asleep. There's the Oura Ring, there's the Apple Watch, as you said, all the different smartwatches. There are even non-wearable devices which can track when you fall asleep and how long you're asleep. And it gives the patient a better idea of, one, their sleep hygiene. Are you really falling asleep at 9 p.m.? Are you really waking up at 6 a.m.? It also gives them information about their blood oxygen, their heart rate, their respiratory rate. And I think if patients have objective data, it helps them better able to make smarter choices in the long term. So the wearable devices, I think, are a great introduction, and it's something that we're looking more into incorporating in just regular routine healthcare in our sleep clinic.
Yeah. What other advancements in sleep medicine are most promising for improving heart health?
Well, and it's been on the media a lot lately. It just got it approved by the FDA. I believe it was December 21st, 2024. The weight loss drug Zepbound. The generic name is tirzepatide. And it's marketed by the drug company Eli Lilly. And it just got FDA approved for the treatment of moderate to severe sleep apnea in patients with obesity. And we're always looking for ways to help treat obesity. which is a chronic disease, and it is not that easy for patients to lose weight. So any help and any indication for treating obesity is great. So I think we're moving in the right direction, that we now have sleep apnea as another qualifying criteria for prescribing the weight loss drug Zepbound or tirzepatide.
People talk about, I'm so busy, I can't exercise. You're busy. You're a doctor. How do you fit it in? I mean, I see so many studies that say it doesn't all have to be at the same time. Get up and walk around every hour if you have a sedentary job. How do you fit it in?
Absolutely. First, you got to make the choice. Do you want to do it? A doctor can make a recommendation. Your relative can make the recommendation, but you have to want it for yourself. And then you start slow and walk 5 minutes a day. That's better than sitting down for half an hour. Start 5 minutes a day, then you'll find that you'll progress to 15 minutes, 30 minutes. And I can attest, you become addicted to the exercise. You become addicted to wanting to work out. I use the word addicted, but you become attached to it. It becomes a part of you, and you form a good habit that has long-term good health consequences. Yeah. So if you can find 15 minutes to sit and watch the TV, you can take those 15 minutes to walk around your apartment or walk outside.
And how long does it take to get adjusted to a new sleep schedule? So you're incorporating exercise and you're saying 9 o'clock is what I say. 9 o'clock, I turn off everything. Phones, TV, everything. But how long does your body take to adjust to your new habits?
So everyone's different. The general rule is the brain takes about 3 weeks to develop a habit. Sometimes it may take 30 days. It's a consistency. And also trying not to get discouraged if the first night you go to bed at 9, the next night something disrupts your pattern and you're not able to go to bed at 9 p.m., you end up going later. But just staying consistent, you should see that you're able to maintain that new schedule within about 30 days, I'd say.
I love that. And it's worth it.
And it is worth it.
Dr. Morgan, it has been a pleasure. Thank you so much. This has been a great conversation. As you can see, thank you for sharing all of your insight with our audience. Be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.